I'm Richard Terrell, and I'm one of the founders of Benefit One Insurance Associates. We're an employee benefits firm that specializes in split funding and self-funding for employers from 2 to 2,000. I want to take a little bit of time to talk about the difference between fully insured premiums, fully insured medical programs, and self-funded. Our entire purpose is to be able to reduce the cost of your health care while providing excellent service for your employees. Let's talk about the detail here. Today you're probably with one of the insurance companies, your Blue Shield, Blue Cross, Cigna, and you probably pay a premium. A certain amount of dollars out every month, and that's the amount that you send out. Well, how do they develop that number? They develop that cost by creating what they think the claims might be. That's your claims area. And on top of that, again, you spell claims. On top of that, they put profit, right? Because companies are not in business for nothing. On top of the profit, they're going to put some pooling costs. Pooling costs are based upon what they think the risk might be for the entire pool of employers that are in this group, which are 1,000 employers. So it doesn't depend on what your particular claims are, but what they think the average of all of them might be. So on top of the pooling costs, you're going to have administration costs. What's admin? Admin pays for paying claims. It also pays for the CEO's Mercedes. It pays for an 87-story building in downtown Los Angeles and another 103-story building in New York, in Chicago, and maybe a pointy building in San Francisco. So you've got all of the administration costs in here. And by the way, you don't get to use any of those. All you care about is that your claims are going to get paid accurately, quickly, and with the best possible result for your employees. And on top of that, you've got taxes for an insurance company to pay. California requires that whatever the premium is, that there is a tax to be paid based upon the type of a program in California. And the total of that becomes premium. So let's take an example of something that might happen. Let's say in a particular given year, I said this was profit right here, right? And in a given year, or a given time frame, you had lower claims. You ever been in a situation where you said, I don't know why I sent that premium out so many times over the years because I've never gone to the doctor? Same way with an automobile insurance where you've never had an accident and you keep paying your premiums and they keep rising. Same situation here. But what happens when you have a regular fully insured premium is that if you have lower claims and that came down to here, the rest of it became profit. But that profit is for the insurance company. They didn't send anything back to you, right? Matter of fact, what they probably did was raise your rates next year because of pooling it with everybody else. Let's talk for a second about how it works now. This is fully insured. So how does it work with self-funding? A lot of similarities. Because obviously what you have to have is you've got to have claims. And let's say, for example, that we even think that our claims might be the same as they thought the claims were going to be. So you've got claims down here and you've got claims for a fully insured. But you have no profit, right? For the insurance company to go away. You have no pooling charges, because you don't have that. You've got administration costs. Definitely have to pay for the claims. You definitely have to pay for some stop loss to make sure that you're protected. Stop loss. And you don't have any taxes. Now, your administrative costs should be substantially lower, but we will even assume that they're not. Even before you start looking at claims, you have saved insurance company profit, pooling costs, and taxes, hard costs, that the insurance company is taking out of the premium which you're currently paying. On the self-funded side, let's talk about that same example here. What happens if your claims are actually lower than we anticipate? This is, again, profit. Difference is, it's not the insurance company's profit. This is yours. You keep it. Matter of fact, you probably never paid it out because with self-funding, you pay out claims as they occur, not prepay them and have them sitting in the insurance company's bank account instead of your bank account. So that's how the programs work with fully insured versus self-funding. We have to make sure that you are safe, that your program that you're putting together doesn't get hit with shock claims that will hurt you and hurt your cash flow. And that's what we do as a company, is structure a program that helps you save money so that you can be able to put the dollars that were going to the insurance company and put that into your bank account. Because every dime you save in healthcare is profit.